Okay, well, let's jump back in with some of that, and we'll start up again. We'll be quiet for a minute, and then we'll start.
Okay.
Do you want your mic on now, too? Yeah. Okay.
I'm just trying to get my computer up, that's all. You ready, Paul?
Yep.
Well, a big thanks to my listeners for staying tuned in to the Joan Jerkovich Show here on 910 KINA. We're back with our two guests, Dr. Ron Hunninghake and one of his clients, Roger, who lost, what was that again, Roger, that you lost?
128 pounds.
Whoa, yeah. And Dr. Ron was just telling us we had a little break, and we always have to encourage you to go on my website, joanjerkovich.com, to see our video outtakes, because you'll hear some more of this conversation. But let's go back to Dr. Ron. He wants to talk something about diabetes, because I understand, Roger, you suffer with that too.
Yes, I do.
So go ahead, Dr. Ron. Tell us about the pre-diabetes condition and how this diet and some of the things you're researching can help.
Well, it all kind of started back, I think, about 10, 15 years ago. Dr. Gerald Ravine came up with the concept of Syndrome X, or metabolic syndrome. And that has recently been changed to the name prediabetes. And what we find is that a lot of people, as they gain weight and as their lifestyle deteriorates, they go to the doctor and they see about 4 different things that start to happen. Number one, their belt size starts to increase, and this is what's called central obesity. And that's the visceral fat. The organ fat is starting to develop around the liver and the intestines and the omentum. And that visceral fat is like a new organ that causes insulin resistance. And so consequently, their blood sugar starts to go up and their cholesterol starts to go up, and they start to retain sodium in their vessels, and their blood pressure goes up. And so many people, if you talk to them, I've been to my doctor, and now I got high cholesterol, and I'm on a medication for my high cholesterol. Oh, yeah, by the way, my blood pressure's running high, and I'm on a medicine for my high blood pressure.
Sounds familiar, doesn't it, Roger?
Oh, yes, it does.
And then pretty soon they're on a medicine for their blood sugar finally does get high enough to where they have to go on a medication. And what I think is happening is that people are actually suffering from this Syndrome X or prediabetes, but this is one of the hardest things in medicine to treat because obesity, being overweight, Syndrome X, these are lifestyle issues, and there is no pill that corrects this. Even HCG, it's very effective at helping people begin to lose weight rapidly and to not be hungry. And there are some very positive things about that. But really the true program is the lifestyle transformation that people need to go through in terms of new eating habits, how to deal with when they go to the grocery store, what to buy, how to go out to a restaurant, how to deal with stress and emotional comfort eating, all that has to be taken into consideration. And if you don't, you're just basically dooming people to failure and recidivism. And that's been the story. And that's why most doctors throw up their hands and say, just go in and have bypass surgery or have your stomach stapled. And that's about all most doctors are able to tell their patients to do because they don't have the time or the structure to help the patient relearn their day-to-day habits, which are so necessary in terms of getting this under control.
It's almost not the medical model that people are used to, because, Roger, you yourself were recommended, surgery was recommended to you, bypass surgery.
My regular physician insisted on me going and having the surgery. I just said, no, this is not going to happen.
Because so many medical clinics, unlike yours, Dr. Ron, have the comprehensive program, because I'm happy to hear that you keep impressing that it's got to be a lifestyle change. There are lifestyle issues. It's not just taking a medication or a prescription that's going to make the change.
Right, and we don't recklessly tell people to go off their medicines, but we find one of the very interesting things, this program pretty much pays for itself. People cut their food bill almost in half. They start eating much healthier foods. We do recommend organic foods, and organic foods are much more available these days. And as they improve, we actually have to lower their medicines because as they lose their weight, their blood pressure comes down. They have to lower their blood pressure medicine. They don't need as much diabetes medicine, and very often their lipids, their cholesterol dramatically improves as well. And that's one of the studies that we actually kept track of about 30 people, and we were able to document that there was a dramatic improvement in their lipid status.
So, Dr. Ron, I will tell you, I've called all over Salina and couldn't find anybody doing this, and you're from Wichita. But how do your medical peers, how do they treat you, and how are they happy to have you on board to help their patients like Roger?
Well, I don't know. I don't know exactly what the feeling is. That there is so much cynicism in the area of weight control. I'm sure most of them think that it's just another quick fix program that's not going to really work. And if we were just using HCG alone, and there are clinics that's all they do. You walk in and they give you an HCG prescription. You walk out and that's the program. We don't believe in that, and I've always been a wellness advocate. People who remember me from when I was in Salina, we had a wellness program at Salina Family Physicians, and that's always been the foundation of what I do. But I just see that lifestyle transformation, unless you deal with that, you can't hope to have a sustainable program. You cannot maintain weight loss if you go back to all your old ways. And so the big part of our program is not just to lose losing the weight is what gets people's attention. But once we have their attention, then we are putting them into a number of, we have all these books that we have them read. We have them get more and more interested in taking better care of themselves, and all the various factors that go into improving one's overall health and well-being. That's what we focus on.
So tell me how long the program takes, because obviously it sounds like the exciting part is to see this weight melting off. But how long do you take to actually work with people on these lifestyle issues as well as the diet itself?
If people have less than 20 pounds to lose, they can come in for a short program. It's a 51-day program. But in general, the vast majority of people, we suggest that they do the Simeon's 85-day program, the first half of which you are on the low-calorie diet. We don't do the very low-calorie diet. We do a low-calorie diet, and it's all whole foods. There's no powders or anything like that. We do use a special vitamin supplement packet in order to make sure that no vitamin deficiencies develop, and we do extensive laboratory testing ahead of time. But we have them come in the first half of the program. They're doing the HCG and the low-calorie diet and being seen pretty regularly by the nurse. And during that time, women will typically lose 2/3 of a pound a day. Men will lose as much as a pound to a pound and a half a day. And I can remember when my wife was going through this that I could hear a little scream in the morning when she would get up and another pound was gone, and she was just mystified. And it's amazing. That's the part of the HCG that you really can't, until you experience it, you can't realize how much of a difference that makes in terms of a person's attitude. Now you've got their attention, and then we're doing the lifestyle training. And once they finish the first half of the program, then the maintenance program is where we put them on a no sugar diet. Now they can have all the foods that they want. We don't restrict calories, but most people find when they get to this phase, they've now gotten used to eating a lot less. And I've been through the program twice myself, and I've lost down from 203 down to 176, which doesn't sound like much, but I was actually showing signs of prediabetes myself, and I had written the book, and so you until you have the actual experience, you can put yourself through a kind of a head trip and think you're doing well, and not actually do that well. But anyway, so I lost the weight down, and by once you had done that, you find out that you just don't need to eat as much as you thought you had to, and so my portion sizes have reduced. Roger, would you say that's true for you too? That you notice that you just don't need as much as what you thought you used to?
Yes, that's very true.
Yeah, and so there's a retraining of what you think you have to eat, and it's not like you're fooling yourself. I just think you get a more efficient metabolism going, and you don't need all the extra things that people put in. And our culture is just famous for just overloading. Our restaurants these days, give you double portion sizes of what you need. And so we kind of retrain people about portions. We get them thinking about what is a whole food, what are healthy foods, the importance of clean foods, organic foods, and then get some You don't have to do an extensive amount of exercising on this program, though we do encourage a regular exercise component, and then dealing with some of the underlying stress factors that have kept people into comfort eating, because that's the thing that I think gets a lot of people, is that when they're stressed, they turn to food as a way of trying to balm their suffering.
And that's almost, in some ways, and I've seen, and I've even had periods of what I would say were stressful times where I did find comfort in food. And, it's in what you always want to migrate toward is the high carbohydrate, high salt, high fat. How does this program help people break those almost addictions?
Well, first of all, if you look at even like alcohol addiction or any kind of addiction, you have to take the people away from the addicting foods. And the simian foods, there's only like 29 foods that are on the simian plant. So we don't give people a whole bunch of choices, but they're very good, like they're apples and strawberries and the meats and about 8 different really good vegetables that they can eat. And these are very low glycemic foods. And so we kind of get them used to eating just real food again, and what that's like, and how it doesn't take as much real food to be satisfying. And then after a while, we kind of help people begin to see that, more often than not, if you run the experiment on yourself, I used to eat like chocolate cupcakes and Pepsis was my comfort food. But I began to realize that after I'd eat those things, I just really felt terrible. It kind of tasted good going down, but then when I actually experienced how I felt for the next 4 to 5 hours, I was tired, I was irritable, I really did, my stomach was upset. So once you begin to kind of help people experience what they're actually doing to themselves, then they wake up and start making better choices. No one can impose their choice upon you, and you always have the freedom to make a better choice, but you have to know what is a better choice. And many people don't even know what a better choice is.
I know when I overindulge on fudge or something like that at holidays, I feel like a poisoned pup for days afterwards.
Well, it is. It sounds to me, in talking to both of you here, that it is like an addiction. Just cut it off. Just get your body trained to not want it or crave it, or even, kind of like an addict. You got to just go cold turkey a little bit. So, Dr. Ron, we're going to wrap up our segment here in a couple minutes. Is there one last thing that you want to bring to the table?
Well, I think the main thing is that people have experienced a lot of hopelessness in this area. There's a lot of stigmatism and frustration and depression surrounding this, and I think they need a structured program, a well-designed program that's been around for 60 years, and they need to be with people who are concerned about them being successful and for the long term, and that's what we're trying to create here with the Reardon Clinic RX HCG program. RX meaning it's a prescription, it's not the homeopathic. So
how can they get a hold of you and your program?
Well, they can go to our website, reardonclinic.org, or they can call in. Our number is 316-682-3100, and they can ask for Meg. Meg is our health educator nurse that does the bulk of the program, and she can talk to them and kind of spend a little time and explain, answer their questions to see if this is right for them. We also have a call-in time, or we have a little call-in show every Tuesday night that they can call in and get the time and the number for that. And it's a 1-hour program that anyone can call in, people who have been on the program before or people who are interested in it, and kind of get a sense for the long-term support that we give people.
Thanks so much, Dr. Ron, for coming on and talking to us.
Thank you, Joan. Appreciate the invitation.
You bet. Well, we're going to take a little break again. We're going to be back with Roger. He's going to wrap it up for us. But this is Joan with the Joan Jerkovich Show. That number that Dr. Ron gave us again is 316-682-3100. Call and talk to Meg. And I think it's something that you might want to take a look at, certainly if your health is at issue, the prediabetes or other health concerns that you have. And be sure to go to our video outtakes podcast, links to iTunes, and my blogs on joanjerkovich.com. We'll be back on 910 KINA Salina.
He's still on the phone.
Thanks, Dr. Ron.
Hey, Joan, good job. How long you been doing this?